feel like the initial were spicy at the front. The other ones are just heat.
Hi, I'm David Voorhees, host of Running Hot. With me today, Wil Franklin, President and CEO of Casey Cares. Thank you for joining.
Yeah.
Good to see you.
Happy to be here.
So for the audience and for you, we've got 6 sauces. We say 5 are for the audience. The 6th one's for me and charity. So $1,000 is charity of your choice. I assume you have the charity picked out?
Casey Care.
Yeah, I kind of figured that. I figured that one was good. So why don't you tell us a little bit about Casey Care?
Sure. So we're a nonprofit community health center. We serve about 23,000 patients across the Kansas City metro area. All of our locations are on the Missouri side, but we serve patients across both states. But most of our patients are below the 200% level of poverty. So Medicaid, uninsured, underinsured. A lot of hardworking folks who are shift workers, who work in restaurant industry, construction, but we provide medical care, dental, behavioral health, substance use, and pharmacy services as well, and some wraparound services too. We have some case management services as well, especially related to some specialty care that we do, such as HIV. We're the largest HIV provider in the region.
Wow.
So
Okay.
yeah.
Well, we'll make sure that $1,000 goes to good cause.
Definitely. So.
All right, well, let's get started. First one is on your side, so I'll let you grab it.
Okay, this one right here?
Yes, sir.
All right.
So this one, interestingly enough, although the name seems like it should be censored,
Right.
in my opinion, is my most favorite. So,
oh, really? Okay.
Yeah.
I like the pear aspect.
It brings it in. It definitely does. So
All right.
this one is Little Dick's Big Flavor Ghost Pepper Pear.
I like that one.
Yeah, I mean it has a little tiny zip, but not really anything that should be too bad for you. If it does, the next 5 are going to be really bad.
I did some evaluations as a part of a grant for some kids in a school district that were really struggling. And there was about 13 kids. I did full evaluation, like learning, psychological history, did a bunch of testing, and almost every kid that I tested in that school district was about 2 to 3 years behind academically.
Wow.
And also struggling with not just behavioral health symptoms in the classroom, but they were systemic in nature, and that they'd also experienced a lot of trauma. So domestic violence, things like that, and or public violence. And I think what struck me was the grant ended, but I was like, well, hey, what's going to happen? They were like, well, you did your job. And so all these kids in my mind needed an IEP with their school district. And so I went to special school district and advocated, and I went to every kid's IEP as a volunteer because I felt like that shouldn't be the end of the road. But in the process, I got really discouraged because that school district was so far behind. They basically said, well, every kid in that district is behind. And so that's where I started really getting involved in safety net healthcare, not just behavioral health. I remember going to the CEO of the foundation and asking if they were going to fund Casey Care, which wasn't a federally qualified health center yet at that time. It was a free health care clinic. And I asked, were you going to give them money, in perpetuity? Because otherwise sustainability is going to be hard for this organization, especially with such great outcomes. It's still going to be, there's not really a business case. And she asked me what I recommended, and I said I think they should apply to be a federally qualified health center. So she asked if I would write that up. I did. I guess they gave that to him because they ended up getting a planning grant to become a federally qualified health center. And then I guess it was about 2-3 years later, I got a call from a recruiter one day, and they said there's a new federally qualified health center in Kansas City, and they need a new CEO. And I was like, what's the name of it? And they were like, Casey Care Health Center. I was like, oh, well, it's kind of my fault. So that's kind of how I wound up in Kansas City.
Okay, let's get into
All right.
sauce 2.
All right.
I feel like you flexed a little bit when you said you're from Louisiana, so
Well,
hot sauces.
I feel a lot of pressure.
Okay.
Because I grew up eating spicy food,
Okay.
but like I feel like I'm full
Are you now
Midwest
for full Midwest, very little
conversion,
spice? Okay.
right? And so, who knows? This could go either way. I found a sweat towel in my car, and I was like, I should probably bring that in because my head's gonna probably start sweating here soon.
So we got a little hot ones, Verde, Los Calientes. So interesting, family man. We were talking about your kids beforehand.
Sure.
You are also in behavioral health, and oftentimes that can be a challenge to shut off that part of your brain.
Oh yeah.
Okay, this is not clinical. This is family. So how
Sure.
have you been able to balance your background in psychology and counseling with being a father and husband?
Sure. Well, it probably doesn't help that my wife is a family therapist by training. So a lot of times what that means is our kids don't talk to us probably coach their friends to just walk through, right?
Don't make eye contact.
Don't say anything. You just keep moving,
That's awesome.
Because I've seen my kids kind of, be like, ugh, like that when one of their friends stops and there's one question, and they're just like, oh no, we're going to be here for a while. So
We're going to unpack this, so just take a seat.
But we're really lucky. Our kids are pretty amazing, very psychologically minded. I feel like early on they were experts at adult behavior far more than I was an expert in their behavior. I think my oldest daughter taught me so many lessons. I still tell this story this day, but I think she was like in first grade, really young. And I was trying to get her to clean her room up before bedtime. She's like, well, why do we have to do it right now? And I was like, well, it's a great way to start the day. There's a good habit to form and things like that. And I was going through all these explanations, and she just looked at me, and she was like, the way I see it, you have two choices. And I was like, wait, I thought I gave the choices. She was like, I have choices too. And I was like, okay, well, tell me about that. And she was like, well, since my room being clean seems to be more important to you than it is to me, you can either help me right now do it, or you can just wait till tomorrow when I can do it with plenty of time. And I was like, yeah. I was like, well, I wasn't sure. I was like, I went to graduate school for clinical psych, and nothing prepares you for that, for someone to be such an expert on your behavior, right, to flip it on you. And so it's a humbling experience sometimes. Because you think you may have the upper hand, and you never have the upper hand whatsoever. And so I remember thinking that was one of those phone a friend moments. Like, I'm really proud of her, but I really wanted her to do this, and this didn't seem to be like a decision, right? Like,
and her response was so good.
Right.
Part of you was so impressed, and the other part was like, clean the room.
But so, over the years, I've just been amazed that, I've had to learn that, like, wait, you may think but you don't. And so I've learned that, the same skills that apply in the therapy room, just listening and being present are kind of what's most important. But it's always a balancing act, right? And to make sure, sometimes you get trained so much to pathologize, right? And there's a lot of range of issues that are completely normal, right?
Oh, right.
And, helping people understand the difference between being depressed versus sad, that's two different things.
Yes.
It's very normal to be sad about lots of things. So just making sure that, you don't pathologize things or things like that. But I've always tried to have a strengths-based kind of mindset, both in my clinical work when I was younger, but then also in parenting, and just recognize that every kid is very different.
All right, let's get into number 3.
All right. What do we have here? It's got a dragon. Oh, it's dragon repellent.
It does. I will tell you, it's more intimidating looking than it is flavor-wise, but it was really good when we went and tried it out. So, you're recruited, you come in, you are adopting business practices with some of your clinical background and training in those things. So, how difficult is it to take something that is something that's needed in the community, that's focusing on someone's health, but also running it like a business?
Trying to normalize the the tension that exists between those two things. I think there's always going to be a tension point between, especially in a nonprofit sector, between the margin and the mission.
Right.
And so we've worked really hard to normalize that tension point and recognize we make lots of choices as an organization. Some decisions are going to be completely mission-oriented because it's the right thing to do, right? Some decisions we make are going to be more on the margin end because we need sustainability so that we're here not just today, but for years to come for the patients. And so I think a lot of it is trying to normalize that and then live in that place where you can get in the middle as possible, right? And recognize that there's lots of ways to get there. So I think the more we can lean in to be creative and innovative and kind of challenge assumptions and recognize that there is conflict and tension and that that's normal. I think that's the name of the game.
You know, I don't like to live in the past. You know, I think studying the past is huge. You need to understand history. But there is something that I deeply miss, and that is healthy debate.
Mm-hmm.
Healthy challenging of established, norms, and really having an okay ability to disagree with you in a safe way, if that
Sure.
makes sense. And so as you were walking through, establishing norms but challenging each other and working through those things, often reminded me of thinking, well, it's hard to do that now in a system where sometimes disagreement is offensive. All right, so we're into extreme hot sauce. Pain is good.
All right.
It's another one from our friends at Spice and Foods.
All right. So what number is this? 4?
We made it to the other side. What do you think of that one?
I feel like the heat is like afterwards on this
Yeah.
one. It's not, no. In some ways, it's not as hot as this one, but you feel this one afterwards more.
Oh boy, about to sneeze. I want to prevent. I don't think I've ever done that. That one was close. We'll have to do like a little snippet of that, like. Oh. So I don't want to get into politics, but I'm gonna circumnavigate my way around it because I think it's important to this next question. You in your role obviously rely on federal funding, and then that changes every election cycle because you're dealing with competing parties that have competing interests in different things. So you know that your constant is delivery of care. How do you work with different parties where there are different opinions and still maintain a high quality of care and relaying that to members of your team that might have a affection for one side or the other?
Sure. Well, one of I think the cool things about community health centers is that historically they have had bipartisan support. And in fact, Missouri, of all places, was a leader of that bipartisan support with former Senator Kit Bond. I think, especially behind closed doors, I feel like a lot of our political leaders are a little bit more open to the notion that there's a middle ground.
Right.
And I think sometimes just the world of politics right now, you get them in front of an audience and they feel like they need to pander to one extreme side or the other.
Right.
And so, but I find behind closed doors, most of them want something that's smart
Right.
and makes sense. And so it's how can we appeal to that middle ground more often and let the middle ground be okay.
Right.
How you feeling?
So far, so good.
We're on to number 5. This
All
one, I'm telling you, is the step up.
Okay.
I'm just preparing you. This is the bomb beyond insanity.
Literally, right?
So we are stepping up. What do you think?
That one's got a slow build. The more you eat of it, too.
A little more.
I almost feel like I need to keep eating to stop it.
You have such a important topic and one that requires a lot of deep thought. And now I put you into the place where it's very difficult to have deep thought.
I know, right?
And then to articulate your thoughts at a high level. So we got the really good stuff out of the way. Maybe I'll take it easy on you on number 5. So when you think about the transition in which you're in now, in the sense of the reshaping of government and some of the funding, so how do you express to members of your team and maybe members of the community that while there are changes, that doesn't change the devotion or it doesn't change the mission, and we're going to get everything we can out of this to deliver the product or service that we have?
Sure. I mean, we have a set of values we operate by, our culture code. So really they're like behavioral kind of statements that we operate by. And the first one on the list is patients first.
Okay.
And so part of that conversation is recognizing, look, the healthcare landscape is constantly shifting. It's changed a lot in the last 10 years. The reimbursement models are always going to be changing. But quality and taking care of our patients is number one. If we do that well, no matter what the reimbursement on the back end looks like, we'll figure that out. We have a lot of smart people who are very dedicated to figuring it out. And so I really try and focus on, one, treating our staff as the first customer in the organization.
Right.
Because I feel like that's what connects people to high-quality patient care. And so leaning in on how do we, no matter what the back end looks like, keeping the front end very focused on high quality, respect, dignity that everybody deserves to have, no matter your ability to pay, whether you're homeless, whether you're not homeless, whether you have a history of substance abuse or whether you don't, you know. And so operating from a value-based model first, I think, is how we get through it. Yeah, I'm feeling the heat.
I gotta say,
But
well done. I mean, I hit you with a very difficult question, and it gives me no joy to watch you struggle.
and struggle.
But I was like, you're in it, man. I can see it. You are in it.
Well, I'm sweating, but like I feel like I'm doing okay though.
Oh, you're doing
Yeah,
great.
yeah.
You're doing great. So here, I'm going to hand this to you.
The last one.
Yeah, you go ahead and read what it is.
Oh, Grinders, Death Nectar.
Mm-hmm.
All right.
Death Nectar.
Again, the delayed response.
Mm-hmm. This one will creep up on you. I've got a cup of questions.
Oh, okay.
And I usually pick a few because they're easy answers, but they're kind of fun. Mind you, I'm also delaying so it continues to hit you.
Yeah, I feel that one has more of a. I feel like the initial were spicy at the front. The other ones are just heat. So is it okay to drink the milk now?
Well, go for it.
All right.
Go for it. All right, so we're going to start with, if your life had a theme song, what would it be?
That's a good question. I was just listening to the song the other day. I was a skateboarder when I was young.
Okay.
So I always loved the Red Hot Chili Peppers.
Yeah?
I still do. And I love that song, Wet Sand. It's the idea that, you have to form in the wet sand and bend and mold with things.
Yeah.
And so I feel like my life has been a series of pivots, changes. Some I had control over, some I didn't. And the name of the game was being adaptive.
Yeah.
So I guess I'd have to go with that.
Okay. Then the last thing is, what's one thing about you others would be surprised to learn?
Well, I think probably what I just shared about you, that I was,
Skater?
a skater, and I was actually sponsored by the local skate shop when I was
That is awesome.
a kid, and I had the shaved head up to here with the long hair on top. That
Okay, now that's something that people. So you had. Okay.
yeah, the full thing. So it was, it would hang down really long, but then if I pulled it up, it was shaved underneath, and so yeah, that was my jam for a while as a kid.
Wil Franklin, Casey Kerr, thank you for being a guest. You made it.
I made it.
Congratulations.
Thank you, David. Appreciate it.
David Voorhees, running hot. We've had another successful member make it through. So I hope you've enjoyed the conversation as much as I have. Join us next time for our next episode.